Sure. So I think it's been a really great year for different types of immunotherapies for treating aggressive lymphomas, particularly non-Hodgkin lymphoma. And the area that I specialize in is aggressive B-cell non-Hodgkin lymphoma. And as I mentioned, there have been some developments, especially this year. So first of all, there have been some new FDA approvals. So for example, for diffuse large B-cell lymphoma, there is now the approval of an anti-CD19 antibody called tafasitamab in combination with lenalidomide for patients who have relapsed or refractory diffuse large B-cell lymphoma. And this was published in the Lancet Oncology by Gilles Sal and co-authors. And they found that they were able to use this relatively simple treatment, which involves an antibody and a pill-based therapy, lenalidomide. And patients who had lower risk disease could have durable remissions, and some patients remained in remission even up to 1 year or beyond. And so this is a very convenient and straightforward type of therapy that community oncologists or anyone could use for patients with relapsed or refractory diffuse large B-cell lymphoma. But the CD19 target is very well known to us in diffuse large B-cell lymphoma because it is the target of CAR T-cell therapies. And in addition to what we already know, having approvals for CAR T-cell therapy for relapsed or refractory diffuse large B-cell lymphoma, we saw this year that CAR T-cell therapy got approved for a different type of lymphoma, mantle cell lymphoma. And this was on the basis of the ZUMA-2 clinical trial that showed actually very good results with a high overall response rate of around 90% for brexucabtagene soluzil or Tecartus, and durable remissions in many patients. And so this is now FDA approved for mantle cell. In addition to CAR T-cell therapy, other immunotherapies have come up, such as antibody drug conjugates. So this is where you have an antibody, such as an anti-CD19, that has a targeted chemotherapy attached to it. An example of this is there's a drug called polatuzumab, which the antibody targets CD79B and brings chemotherapy with it. And this was approved this year by the FDA in combination with chemotherapy called bendamustine and rituximab. And the combination of Polivy and bendamustine, again, had some patients that had durable remissions greater than a year. And some of the data will be updated this year at ASH to see that some patients had even longer remissions. Finally, there's a new category of immunotherapies that are showing excellent promise in diffuse large B-cell lymphoma. And these are the bispecific antibodies, or people call them BiTEs. And what this is an antibody that on one side will target something, like, for example, CD20 has been an interesting target for these BiTEs. But on the other side, they have a way to grab the CD3 positive T cells and thereby bring them closer to the tumor. And then these T cells are able to affect the tumor by shrinking it or doing immunologic cell death. And although none of these are FDA approved yet, multiple companies, including Regeneron and others, Genentech, have showed really good results in the relapsed refractory setting and are now being combined or even being given in the upfront setting in clinical trials in combination with R-CHOP. So I think there's a lot of excitement for immunotherapies that have gone on this year. Finally, I just want to touch on one other type of CAR T-cell therapy. In fact, not a CAR T-cell at all, it's a CAR NK cell. So T-cells are one type of lymphocyte that you can put a CAR into. And natural killer cells are another type. And this year, a paper came out in the New England Journal of Medicine by Katie Rezvani and MD Anderson, showing that NK cells can also be targeted against CD19 in diffuse large B-cell lymphoma. And they saw actually quite good results in terms of efficacy with very little toxicity. And this technology has now been licensed by Takeda. And I understand that they will be doing a larger trial to see if this CAR NK cell technology can be brought to the clinic.